broadcasting live from Houston, from the space city to the world. You are watching NowMedia Television.
Hello everyone, welcome to Pain Diaries. I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine here in Houston, Texas. Today we've prepared a very interesting show. We have two very successful guests, Dr. Silky Patel, a top-notch interventional spine specialist here in Houston. She's offering first-class treatments for spine and sports pain. And Dr. Dawn Sparks, founder of Lighthouse Healing. Also, we're going to tell you everything you need to know about back pain and back strains. And we're going to answer all of your questions about everything related to the back pain. This is Pain Diaries. Hi, welcome back. I'm going to talk to you about some little news briefs to start. First, we're going to talk about how air pollution may trigger lung cancer. Scientists have long known that air pollution can be linked with an increased risk of lung cancer in people who have never smoked. New research describes one mechanism that might explain how. Findings presented at the European Society for Medical Oncology Presidential Symposium in Paris suggest that air pollution can trigger lung cancer in people with no history of smoking because some air pollutant particles may promote changes in the cells in their airways. In particular, more exposure to airborne particulate matter or particle pollution can drive rapid changes in airway cells that have mutations in a gene called EGFR, which are seen in about half of people with lung cancer who have never smoked, and another gene linked to lung cancer called KRAS, according to the research. Did you know walking can lower the risk of early death? According to a new study, you can reduce your risk for cancer, heart disease, and early death by getting up to 10,000 steps a day. A similar study published by the same team found that walking 10,000 steps a day lowered risk for dementia by 50%. Risk decreased by 25% with as few as 3,800 steps a day, according to the previous study. Calls to prevent suicide with the Suicide Prevention Lifetime rose 45% after changeover to a 988 number. After the summer launch of the new 988 Suicide and Crisis Lifeline number, calls to the Lifeline increased 45% compared with the same time last year, and the majority of those calls were connected to a counselor, according to the U.S. Department of Health and Human Services. According to August data, a total of 361,140 calls, chats, and texts were routed to a 988 Lifeline call center. Among them, 84% of calls, 97% of chats, and 98% of texts were answered and engaged by a counselor, representing a total of about 88% of people who reached out to the Lifeline. The remaining 12% were disconnected before being engaged by a counselor, according to the data. On average, it took about 42 seconds for calls, chats, or texts to be answered after an automated greeting. And the average amount of time counselors spent talking, chatting, or texting with contacts was about 18 minutes and 49 seconds. Did you know ketamine infusions improve symptoms of depression, anxiety, and suicidal ideation? People who got intravenous ketamine at 3 private ketamine infusion clinics had significant improvement in symptoms of depression, anxiety, and suicidal ideation, a new study says. The study, published in the Journal of Clinical Psychiatry, adds to a growing body of research showing ketamine's promise in treating these conditions. It gives some more real-world data, which is incredibly important because it helps show its potential to work in the more general population. But the study leaves some critical gaps, including data on adverse effects and direct comparisons to other options that make it difficult to conclude how it should be used according to the specialists. Ketamine is a powerful medication used in hospitals primarily as an anesthetic. It's also used illegally as a club drug that creates an intense high and dissociative effects. Because it's not approved to treat depression and thus it's used for that purpose off-label, it's not covered by insurance even when it's recommended by a doctor. It's time to go to a commercial break, but coming back, we are going to talk with Dr. Silky Patel, our top-notch interventional spine specialist here in Houston, Texas, who's also offering first-class treatment for spine and sports pain. I'm Dr. Suzanne Manzi, and you're watching Pain Diaries. Hi, Dr. Suzanne Manzi here, back at Pain Diaries. I'm really happy to present Silky Patel, MD. She's a top interventional spine specialist here in Houston, and she's offering first-class treatments for spine and sports pain. It's been a great story we've had over the past 10 years here in Houston. We've done our training separately across the country over the years, and we've reunited in Houston without even knowing each other. We reached out to each other, found out we were two female docs in a male-dominated world of pain management. I remember reaching out to her and we decided to meet for lunch about 10 years ago to the month. And it's a wild ride ever since. Dr. Patel and I basically sat down, we had dinner one evening together, got to know each other, and we decided to invite all our other female physician pain doctor friends to dinner. And so it began, the Houston Pain Girls. So Dr. Patel, it's been such a great time over the past 10 years to be your colleague in the same city. We've had a great time together. So tell me a little bit about your story.
Well, first of all, thank you so much, Suzanne, for having me here today. And just recollecting a little bit about how it did start. That's one thing that I do love about us females, that even across the city, technically we're in the same field, yet we never saw each other as competitors. And I feel like we've done a really great job across Houston, kind of bringing together all the females in our specialty. And not only did we build camaraderie amongst each other as females and friends, but also as physicians and colleagues and surgeons, because they call medicine an art for a reason. And by putting our brains together and going to dinner and sometimes discussing cases or learning about new techniques, I think all these things that we do actually help empower us to treat our patients better. So thank you for taking that journey with me in being able to start this Houston Pain Girls group.
Absolutely. I'm so excited you're here so we can tell our story. And now it's funny, when we go to the conferences on a national level, we're kind of well known around the country amongst our female colleagues, like, oh, that's the Houston group. They have such a close-knit group, and they bounce ideas off each other, and they're not jealous of each other. They really just love to be a one close-knit group. We have our text stream where we can ask each other questions and really advance the field together. And it's been a great time, and I'm excited that you're here with me today. We can share our 10-year story.
Of course. Thanks again for having me.
Absolutely. So tell me some of your challenges that you've been up against over the past few years. I know you've been through a few different practices now, and tell me about that and your challenges that face and lie ahead.
Yeah. So I guess my story, I went to UTMB in Galveston, and a wonderful medical school, but I think a lot of people in our community don't know what it takes to actually be an MD here in the United States of America. So of course you start kindergarten to 12th grade, right? That's 12 years of education. After that you go to undergraduate, which is 4 years of undergraduate college. After that you go to 4 years of a graduate medical school. After that you go to 1 year of an internship. I did my internship at UT Houston. In the medical center, which is great. And after that, you do a residency. I did my residency in Loyola, Chicago, and that's 3 years of a physical medicine rehabilitation residency, and then 1 year of an interventional pain fellowship out at Loma Linda, California. So gosh, if you add that up, that's over 25 years of education. And us as females, I think, you get out of 25 years of education and you're almost, mid-30s, and you think, now what do I do? And of course, on my mind was, maybe wanting to start a family. But I did come here to Houston, and the first job that I accepted was actually at the UT Houston Neurosurgery Department. And so here I am balancing, do I have my first child or start the interventional pain practice service line at UT Houston Neurosurgery? And which one did I choose? I chose to start the interventional pain department, and it was a wild ride, but being the first interventional pain physician amongst a huge department, all of neurosurgeons, definitely has its challenges. I developed new protocols. I worked with the neurosurgeons to kind of teach them about how does interventional pain actually fit into the field of neurosurgery. Located at I-10 in Memorial City, I grew a great practice, and I was actually doing 99% spine. Yet being trained in physical medicine rehabilitation, my passion has also been for sports. And so an orthopedic group approached me that if I wanted to join them, and I took the opportunity because really my passion lies in not only spine, it lies in spine and sports. And so there I was, again, the first interventional pain physician in now an orthopedic group. So same thing. I developed new protocols, also from an orthopedic standpoint. I developed Silky Patel MD, and it was a wonderful ride. And now not only could I treat the spine, I was doing interventional pain procedures for knees, for shoulders, for wrists, for ankles. So I really got to expand my repertoire, and again, was probably one of the only females there at the time that I came, and one of the only interventional spine people being able to treat from that perspective. And so that was an amazing ride as well. And I think that, as a female, being the only female there, I really was able to help treat so many more female patients. And so I think with each part of the journey of my life, I was able to expand my repertoire, treat more patients, and yeah, now I have 2 beautiful kids to show for it.
That's fantastic. Thank you for sharing that. I've been there, developing programs when I first came out too. I started the interventional pain department over at UT, but in the medical center, and that's kind of where we were parallel in the same field and departments, doing our pain management separately. And it takes a lot to really build those protocols and train the staff and have them understand how we fit into the team of the surgeons and the regular medical doctors that are caring for patients. And it takes so much education to really show them what needs to be done in order to treat the patient from a pain standpoint and as a whole, especially where interventional procedures can really help change their lives. Sometimes an epidural, little steroid in the joint, makes all the difference in the world to make people functional again.
That's true. That's true.
So how is it having kids and being a doctor?
It's all about that balance. In many ways, it has its challenges because you want to give it your all and your 100% every single day to your patients. And that's what I wake up wanting to do every time. But then there's also this little part of my heart that feels that mom guilt because, every day your kids are saying, can you drop me to school? Can you pick me up to school? How come you're not that mom that's there during lunch every day? And so, of course, balancing that emotionally, physically has its challenges. But in the end, I feel that being a mother and being a physician actually complements both. I think being a mother has taught me to be a more compassionate physician. I think being able to be a physician and a surgeon has made me a better mother because I know basically how to treat physical ailments and emotional ailments at the same time. It's definitely come in handy before. So I think although it has its challenges trying to balance both, if I didn't have one without the other, I don't think I would be able to give my 100% to basically my top two priorities in life.
Awesome. I know I look to you as a role model. I'm kind of late to the game compared to all the other pain ladies, and I even covered for you for maternity leave. That was before I even had kids, and I know I have these great questions to look forward to when my kids get to be school age as well. It's going to be a lot of fun, and I do have the guilt now, but it's nice having videos sent to me all day about what's actually going on at home. But yeah, it's challenging. The mom guilt's a real thing, and when we do go home, that hour or 2 hours we do have with our kids is so important for that one-on-one time. And you're right, I think being a doctor, we have a little bit of an edge to kind of know what to do with our kids sometimes when they're being difficult or when they're not feeling well. It's definitely an advantage.
Oh, for sure.
So, do you find that it's hard to put yourself first because of all these other things going on?
Yes, I think that actually in my next chapter of my life, I am going to probably focus on that from two perspectives, personally and professionally. So professionally, I've taken SilkyPatelMD.com and actually decided to be at Methodist West Hospital, where I'm actually helping build the interventional spine program there. So I'm very excited, kind of returning back to my I-10 corridor and being able to bring my skills, my regenerative skills, my kind of cutting edge technology, and actually my just compassion for treating a whole new scope of patients to the I-10 corridor. So I'll be in Memorial City, which is my stomping ground since over a decade ago, and also in Katy. And so professionally, I'm so excited to be able to expand and basically bring that to a whole new part of Houston. And also, personally, I think I am going to be taking some time now to, I don't know, you tell me, since you're in high school, you think, I want to be a physician. How am I going to do better in that next science test, the next MCAT, the next board exam, and it's test after test, and applying from internship to residency to fellowship, moving across the country, trying to get into the best programs you can get to, and then hours of call. And after that, like we said, developing the program at UT Houston Neurosurgery, developing the program at one of the largest orthopedic groups in the country right now. Then after that, now I'm going to be developing the same protocols at Methodist West. So I think professionally I have definitely accomplished a lot. But personally, I think I do, in the next chapter of my life, kind of want to take a step back and re-explore some interests, some hobbies maybe outside of medicine and children. That will be, I think, a struggle, because I think in medicine, especially, and probably as females as well, you think right when you get home from the operating room and from the office, oh gosh, the mom guilt fits in, and you say, what am I going to do for my kids? And so yeah, a lot of the time I'll return from the office from 6, from 6 to 9, you do the dinner bedtime routine, and from 9 to midnight, I'm back at my computer, finishing operative notes, finishing clinic notes, and then after that, planning for the next day for the kids. So it's pretty much a 6 a.m. to midnight job every day. But for the next chapter of my life, I'm thinking, take some time for myself, and I have you to thank for it. Dr. Suzanne Manzi here recently encouraged me to join a gym. So sometimes on that 9 p.m. to midnight hour, I'll head to the gym and do some sit-ups and have some mental clarity. And so I have, and that's, I think, one of the best things about our group. We look towards each other not only for really bouncing those tough surgical cases off of, but then you do that mental check and say, what have you done for yourself lately? And I do thank you for that, and I think that giving back to yourself and sometimes putting yourself first, again, it's a loop type of a effect. I think if you treat yourself better, you become a better human being, which in the end helps you become a better physician and a mother. So yeah, I'm going to be going to the gym at least a couple of nights a week, trying to do some yoga, some sit-ups, and getting some mental clarity.
I love
things.
it. And that's why I haven't seen you, because I'm there at 5:30 a.m.
Hey, it's either before the OR or after the kids go to sleep.
Or after, exactly. Yeah. No, I'm glad we did that class together a couple weeks ago, but I probably won't be seeing you during the week. Well, thank you so much. I really appreciate you being here with us today on Pain Diaries.
Thank you for having me.
It's time to go to a commercial break, but coming back, we're going to talk about back pain and sprains.
Are you a business owner feeling overwhelmed or burnt out with no energy left for what's most important to you? In order to effectively run your business and maximize your profits, you have got to be the best possible you that you can be. Now is the time to reclaim your energy, master your schedule, and maximize your profits so you can effectively run your business rather than it running you. It's time to become the CEO of your business and life. I'm Jen Godet, a business strategist and life coach. I work with overwhelmed business owners who feel stuck in a rut and depleted. I teach you how to stop doing the things that aren't making you money and start prioritizing the things that bring you energy, joy, and lasting impact. I'm a human performance specialist and an international best-selling author. I've helped countless people all over the world to learn the art of saying no, overcome their fear, and maximize their performance. Let's get you to live your best possible reality. Start today and become the CEO of your business and your life.
Hi, my name is Yang Tran. For the past few years, I have delivered personalized insurance solutions to protect each one of our clients' interests. At DOS Insurance, we offer an array of personal lines of products such as living benefits, college education, tax-free retirement, mortgage, and income protection. We also offer commercial insurance and have access to markets for just about any type of businesses. At our full-service independent agency, you'll find expert agents dedicated to customer satisfaction. We live and work in the community and always keep our clients as our #1 priority. Every situation is unique. Every insurance solution we offer is also unique. That is why at DOS Insurance, we work with multiple carriers to compare pricing and policy options to best meet your needs with optimum coverage at a competitive price. Experience the advantage of an independent agency. Give us a call today at 832-629-9045. Let us be a part of your success in protecting what matters the most.
Hi, welcome back to Pain Diaries. Dr. Suzanne Manzi here of Performance Pain and Sports Medicine. Today we're going to talk about back pain and back sprains. At some point in everybody's life, they'll have experienced some low back pain. So I'm going to talk about some anatomy. What makes up our low back? Why does our low back hurt? So I have a model here of the lumbar spine, and this is just a small little model I have in my office, and I just wanted to go through some basic anatomy with you all, just so you can understand what happens to our spine and why our spines hurt sometimes. Now, I'm going to focus on the lumbar spine today. Unfortunately, we age every single day. The calendar changes. We age and degeneration unfortunately happens. The inflammation and the inflammatory basis for disc degeneration likely begins at the time of puberty when we start growing. There's an increased demand for nutrition, and then there is an imbalance that can occur with the pH in our discs. And our discs are the cushiony part between the bones of our spine. So changes can happen in the collagen and the rings of the disc called the annulus. And these start to fail with increased stiffness and increased inflammation in our lives. As you can imagine, there's a continued research surrounding how to prevent this from happening. In my practice at Performance Pain and Sports Medicine, we focus on treating the discs and the degeneration by treating people with regenerative medicine. Our goal is to hopefully help you stop aging and help your pain. So I'm just going to talk through some of the components here of the lumbar spine. Our spine is made up of the bones, the joints. There's ligaments that go on the back of the spine as well that connect us and allow us to move freely and give us motion and stability. We also have the spinal canal where our nerves come through, where our spinal cord ends. Our spinal cord ends at the top of the lumbar spine, and then the nerve roots come down and flow through, and they come out these little holes on either side of the spine here. Now, each hole represents a level based on which numbered bone we're at, and each level goes down the leg to a different nerve root. And we call those dermatomes and myotomes based on whether it's a sensory nerve or a muscular nerve that allow us to control the motion of our legs. Now, the different things can happen to our spine. So first I'm going to talk about the discs. Like I already did, these discs are the little cushioning areas in between the bones. And if you think about a jelly donut, the discs have a ring of fibrous tissue around called the annulus, and on the inside is the nucleus pulposus, and the nucleus is what can basically herniate. So if you hear the word herniation, the herniation could come out the side or directly to the back of the spine. Now, if it goes out to the side of the spine, it can push on these spinal nerves. If that happens, you feel what you can call sciatica, and sciatica is also termed radiculopathy because the nerve is being pushed on right at that nerve root. Radicular means root. So if the disc herniates and touches the disc, you can have a radiation of pain all the way down the leg. Now, this radiation is very uncomfortable because it's nerve pain. And sometimes you don't even have back pain if your disc is touching a nerve. Now, because the nerves come out these little holes called foramen, these are the sides where the nerves come out, the narrowing can occur is called stenosis, and that can happen from multiple factors. Stenosis can happen when the canal's narrow because there's a disc pushing, like we just talked about. The joints back here, these are the facet joints, are the joints that have some synovial fluid in it, just like our knees and shoulders, that allow us to be lubricated and move. So we have flexion and extension and lateral bending and rotation where we can twist. And that's all because of our joints. Now, facet joints are a huge component, but they can become bigger when we have arthritic changes. And arthritis of these joints can also narrow this foramen, which can cause us to have nerve pain down the leg. Other component that can narrow a foramen or even the central canal is this thick ligament that goes through the spinal canal, and it serves as a supporting structure on the inside of the bones in the canal. That can also get thickened as we age. Now, there's procedures that treat all these different types of issues if you have back pain or nerve pain that goes down the leg. Now, stenosis of this ligament might not even necessarily require surgery anymore. There's different treatments that we do as interventional pain physicians that we can really target this area in a minimally invasive way to alleviate the leg pain and the pain that causes stenosis type pain. And that could be pain that goes down the legs and gets better when we sit down. And then when we try to get up and walk again, it's very hard to do. And you can walk a little bit, but not too far, and then you have to sit down again to relieve the stenosis pain. This is why you see people in, let's say, the grocery store leaning forward over a shopping cart. And we call that a positive shopping cart sign because they have lumbar stenosis. And when they bend over, it opens this canal and it allows the nerves to breathe. As soon as they stand up straight again, it makes it more difficult and it closes off that canal, making the stenosis worse, and then they can't walk, which is why when they sit down, it gets better. And then they can walk again for a little bit, and then it gets worse again. And that's why they're hunching over to keep their back and the canal open. So let's talk about the joints now. Now the joints, these facet joints that we talked about, have a nice range of motion, and they allow our spine to move. The range of motion is really important in our spine. And sometimes when these joints become arthritic, this is why we can have some achy low back pain, especially in the morning. We're staying still all night while we sleep. Staying still all night is really a challenge for some people because this aches. Your body wants to move. Your joints are made to move, exercise, move around, not just lay still, not just stay in one position. This is another reason that we can have back pain, especially in the workplace, if we're stuck to a chair all day long and we don't get up. Or when we do decide to get up after sitting for 3 or 4 hours without a break, boom. Oh, I'm so stiff, my back hurts, I can't really get up, because your joints haven't been moving. You've been stuck to the chair or the bed for so long that your joints get stiff and the joint fluid is just not being flowed around as it should be. So this can create kind of like sticky type joint. Sometimes I use the analogy, you wake up like the Tin Man from The Wizard of Oz. You're just all stiff and you have to get the oil going so you can really move around again. Well, that's why it's so important that we exercise our spine. Spinal health is huge. Now, supporting structures of the joints and the discs and the ligament that are inside the spine here per this model are the muscles and the ligaments that are outside the spine. The muscles especially can become degenerated over time if we don't exercise them. All muscles need regular exercise, multiple times a week. It's not just our legs, but our low backs need specific exercises to keep our back strong. There are different devices out there that are now available, which is truly amazing, the technology that has come. But basically, we can even stimulate the muscles to make them come back to life and help regenerate them. You can do all the bird dog exercises and cat-cow exercises and back extensions you want, and that's going to help. But will it reverse the actual muscle changes that can be seen on an MRI? Not necessarily. So again, as interventional pain doctors, my partner and I, Dr. Matt Wiederholtz, are two of the people trained on a special procedure that can help muscles regenerate in the low back for chronic back pain. Because you need those muscles. They're your support system. They're like your back strap, and they really support everything going on. As a physical medicine and rehabilitation doctor, you know, I do brace people, but do I have to brace people? I try to tell people if they need to be braced, it's because that they need some external support because their muscles might not be strong enough to handle what's going on. So I always refer people for physical therapy to start. It's so important to really learn the correct back exercises to do to help with the spine and spine health. Now, the muscles and the ligaments, as the supporting structures, need to be strengthened and re-educated sometimes from a neuromuscular perspective, which is where physical therapy comes in. I work with great therapists around the whole city of Houston, and no matter where you live, there are so many great therapists out there. Physical therapy is a mainstay for us as physical medicine and rehabilitation doctors, as well as all pain doctors who may not be just physical medicine and rehabilitation. So doing physical therapy is the keystone, but you can't go to physical therapy forever. You actually have to do these exercises on your own as you age and get older. It's really important to keep our spines healthy. Our spine is our core. Now, you don't have to go out there and just do 50 crunches every few minutes. No, I mean, I tell patients, like, if your back hurts, I don't want you crunching and bending and twisting your spine. I want you to really just stabilize your core. And we're not just talking about the abdominals, we're talking about the posterior muscles of our spine that support our discs and our joints and all these muscles and ligaments that allow us to have a functional spine. Now, I'm also a proponent of chiropractic therapy. I think a good chiropractor is good in order to keep your spine mobilized and aligned. Not everybody believes in chiropractic care. I do like a good chiropractor because it makes my back feel better. I played Division I basketball. My back is not the best, but I keep it really strong. And I do my planking exercises, and I do my bird dogs, and I do all these strengthening exercises at the gym almost every day because I want to keep my back strong, and I know without my exercise, my back starts aching a little bit. Now, I have had some interventional procedures as well because I do know that they help. The joints can be injected like any other joint, even with just simple steroid injections. But I like people to get better. I don't want to just mask the inflammation with steroid. I look to doing regenerative procedures for joint pain, as well as disc pain. At Performance Pain and Sports Medicine, we offer the latest technologies and regenerative procedures in order to help people regain their function and to get back to what they love doing. When you're in pain, you can't conduct business, and business is the key for all of us. You know, we have to do business every day, whether it be taking care of the kids or going to work every day and running the show as business owners, like I am, just like you are. So again, back pain can impact all of us in such a critical way. It's key to take care of your spine. We only get one. Now, Dr. Wiederholtz and I are, like I said, big proponents of regenerative medicine. There's different ways that we can do regenerative medicine for the lumbar spine. We can do joint injections with PRP or with stem cells that we harvest from your bone marrow. That's basically, we take the bone marrow out of your hip, the back of your hip, and we spin it down in a centrifuge, and then we re-inject it wherever it needs. So we could put it in the joints, and we can also put it in the ligaments and the soft tissue area to help with the healing process. Dr. Wiederholtz is one of the very few docs in the country, and he loves performing the disc seal procedure. Now, disc seal is an injection that goes into the disc, and it helps seal up that annulus, that ring, to keep the jelly from squirting out of the donut. It's a regenerative procedure utilizing fibrin, and fibrin is a naturally occurring gel-like matrix that helps seal those discs. Now, again, like I said in the beginning, the changes happen in the collagen and the annulus or the rings, and they fail due to stiffness and increased inflammation. As we age, we lose water in our discs. We lose mobility, and so that's where it's so important. And the fact that we can help regenerate this area of our spine is huge. It's great technologies that are now out there. So, you know, we at Performance Pain and Sports Medicine are big proponents of treating all these different things that can happen to your spine so we can get you back to being functional again. I just wanted to let you know it's time for a commercial break. Coming back, we will try and answer some of your questions. Again, I'm Dr. Suzanne Manzi, and this is Pain Diaries. Welcome back. I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine, and you're watching Pain Diaries. Today we're talking about back pain and back strains. I know many people have had a lot of questions related to different injuries, so we're here with our new segment called Ask Dr. Manzi. That's me. I'm going to give you some advice on different topics. Just remember, always go to a specialist. So let's start. If you want to come see me, you can call 346-217-1111. www.performancepain.com. We are happy to help here in Houston, Texas, or wherever you live. So let's start. One question: if I work all day on a chair, can I injure my back? Well, I guess the question is, are you working sitting on the chair? Sitting all day, I think like we discussed earlier, can definitely cause your back to become stiff. When we are sitting, we're putting an increased load on our lumbar spine. It's a different type of load than when we're standing. It's actually a lot more. So yes, sitting all day is not healthy for your low back. Our spines were meant to move. That's why we have joints. The discs are not a big fan of just being stuck in one position all day, and neither are your joints. Your muscles are made to move and made to work. So again, sitting all day on a chair, I wouldn't recommend just staying there. It's key to get up, move around, walk, take breaks, and if you can, even get a standing desk. A sit to stand, standing desk where you can go up and down if you really need to be glued to a desk all day is a very great idea for your low back. Another question: how can I prevent a back injury? So prevention is a great way to start to never really have to feel any kind of back pain. The key is keeping your supporting structure strong so that you don't have to have a disc or a ligament or a nerve be affected. Now, I like to describe it as keeping your muscles strong on your low back is like basically having an internal bracing system. You don't want to have an external brace because then your body relies on a back brace. You want to have your body rely on your muscles to keep your spine healthy and strong. So if those muscles are strong, your discs aren't going to have to take excessive load. When the muscles aren't strong, then your discs are vulnerable. You don't want them popping out and herniating and touching a nerve. That's really painful and uncomfortable. So by preventing a back injury, it's really important to work on your back extension exercises, your core strength, and always move. Move, move, move. As a physiatrist and physical medicine and rehab doc, we were taught movement is the best medicine. Exercise is the best medicine. So again, preventing a back injury is key. It's really going to be, you focusing on you so you can take care of business. Okay, another question from our fans here. When should I go see a doctor about back pain? Well, usually I say, you don't need to see me if you just have a small little ache in your back and it goes away after 2 weeks. But if that back pain persists for more than 2 to 3 weeks, I would really recommend seeing somebody. The sign of a lingering pain could be more than just a sprain or a strain, which should just go away with some time and a little bit of rest and some basic exercises. The other thing that you have to be aware of, if you have back pain and you have neurologic symptoms related to that back pain, you definitely need to go see a doctor. So neurologic symptoms mean loss of your bowels or bladder function. That's a big one. If you lose control, you need to go to the emergency room. If you have any kind of nerve pain that goes down your leg, and it's not just the pain in the back anymore, it's literally nerve pain that you think feels like a sciatica kind of pain, or what we call radiculopathy, any kind of weakness or numbness, tingling, I would definitely go see the doctor once that starts. And hopefully it never progresses to that point. But if it does, and if it lasts more than 2 weeks, you definitely want to go see a doctor. But again, you have to be aware if there can be emergencies, and it might be an emergency if you lose function about your bowel or bladder, that's when I would recommend going to the emergency room. One more question. What is the best way to sit on a chair? I would definitely say with your butt. No, joking aside, you definitely want your back to be all the way back against the chair, your legs at 90 degrees, and your head, if you're using a monitor, you want your head to be at a very neutral position so everything is aligned in an ergonomic fashion. I really think this is easy to do because there's so many resources now on the internet where you can look up ergonomic workstation evaluation. And so your workstation can be evaluated. So you can set it up for yourself at home, or sometimes we even have workstation evaluations available if you work for a larger corporation. So sitting in a chair, if you are going to sit, definitely needs to be ergonomically correct. So you have some back love while you're at work. It's time for a commercial break. Right now, coming up, we're going to talk with Dawn Sparks, founder of Lighthouse Healing. I'm Dr. Suzanne Manzi. This is Pain Diaries. Again, if you need to contact me, www.performancepain.com or 346-217-1111. I'd love to see you. I'd love to treat your back pain. And again, we got to keep you in business so that way you can continue to run the show.
This has been a NowMedia television feature presentation. All rights reserved.